Subscribe to our YouTube channel and press the bell icon to get the latest updates.
Hello and welcome to ThePrint. I'm Sravasti Dasgupta. The COVID pandemic is raging in Chhattisgarh and the state is grappling with a massive surge of cases as well as deaths. Joining me today is the Health Minister, Mr. T.S. Singh Deo. Welcome to ThePrint, sir.
Thank you.
My first question to you, sir, is that we have seen a massive surge in deaths in Chhattisgarh. In fact, these deaths have, in a sense, quadrupled in the past month. On March 12th, just to give a sense our viewers, on March 12th, we had 4 deaths in Chhattisgarh. But on 12th April, that number has doubled to 107. So that's a massive jump. So why do you think such a huge jump in deaths is happening in the state, sir?
We have been hit hard. We've been hit very hard by the virus in the second wave. And the figures of death, one is the quantitative figure and the other is the relative figure. It is ironic that the relative figures would show you a lower or reducing death rate, whereas the number of deaths which are taking place are very high. They have crossed 150 even. So the number of deaths is very high. The figures are correlated with the positives that are coming. So what is happening is that the number of positive patients has increased manyfold. Yesterday was again 15,000 plus. So when you relate the deaths to 15,000, the ratio appears to be less. The numbers are very high. So what has hit Chhattisgarh is, you mentioned March, the positive cases would probably have been 200, 300. So it's not just the deaths which have multiplied 30, 40 times. It is the positive cases which have also multiplied 50 times, 60 times, 70 times. So that is what we are seeing, a massive surge in positive cases and resultant high number of deaths.
So I was speaking to doctors here in Raipur as well as in Durg, and these are some of the worst affected districts in the state. And the doctors are of the opinion, sir, that patients are not really treating the virus as seriously as they should, and they are in home isolation. They think it's a cough and a cold that's going to go away, but unfortunately their oxygen levels are dropping, and by the time they're approaching hospitals, it's getting too late to save them. So do you think there has been in a sense a communication or information failure in informing the public about the adverse effects of this disease, sir?
I don't think we could rightly say that there has been a failure in informing. The government, its agencies, people, the media, they have tried to communicate this any number of times that don't take it lightly. What happens is that a large number of cases are asymptomatic. They don't even get caught in the testing regime. They catch the virus and they get well by themselves. Of those who are tested positive, again a large percentage are having low infectivity. Their what we call the viral load is low. Most of them get well. So the sense that seems to get across is that there is not so much to worry about this virus. It can hit people, it can cause death, but see, so many of us are absolutely fine. So I think somewhere in the public perception, you're right to that extent, and the doctors too, that maybe there was a complacency that it's not really harmful to life to that extent. People are dying, but will die, but not to that extent. And somewhere we let our guards down. The ratio of positivity was falling rapidly. It had come down to below 1 in the first week of March. And from the first week of March, we are here today, where from 200 odd cases, we have 15,000 plus cases. The other thing you mentioned about coming late to hospital is very true. And this is a continuing phenomena. People who opt for home isolation, they sort of, feel the comfort of the home isolation is a better option rather than going to hospital. What will we do in hospital? We'll be kept in beds, we'll be kept in enclosed spaces, and people say there is no real medicine, there is no real cure, so why not stay at home? Where they miss out in this is that if your saturation level, your SpO2 levels are going down, sometimes they fall very rapidly. And then if you delay, let's see, we'll get better tomorrow, let's wait for another day. So this 2 or 3 days delay in some cases proves fatal, and 30% of deaths have been reported within 24 hours of reporting to the hospital, and another 10% within 72 hours. So coming late has certainly been one reason, and this virus strain mutation that we are seeing, mutant that we are seeing this time, it has not been scientifically pegged that there is a different mutant which is affecting Chhattisgarh this time, or maybe the rest of the country. But all doctors are of a common view that it is a different variant. It is not the same mutant or the same virus that hit us in the first wave. Cases and patients as they are coming, they are showing different symptoms, and the youth which was not affected last time and the younger children who were not affected last time are also being affected this time, and mortality amongst the age group below 45 is also about 20-25%.
Also, as you mentioned that the youth are getting far more infected in this round of the pandemic as in comparison to 2020, for instance. But a lot of these young people as well as the elder patients that are coming, they are not getting beds. The state is grappling with an acute shortage of beds, whether it is in Raipur, which is the capital, or in Durg, which is nearby, or even Rajnandgaon or other districts. So the shortage of beds is not just because of a lot more patients, but a lot more patients are requiring oxygen support. So how is the government planning to plug this shortage of beds, sir?
One, the major shortage is not in beds as much as ICU beds. So ICU beds is a limitation where we have very little scope to do something immediately. If we have about 500 odd beds in the public sector and another 700 or 800 beds in the private sector, that is it. There is a limit to the number of ICU beds which are available, and a lot of the crisis is also for patients wanting to go to particular hospitals, AIMS, Medical College Raipur, maybe one or two other hospitals in the private sector. So that is where this message goes across that there are no beds. Because those institutions, if they have a capacity of 500 and with ICU capacities of, let us say, 100 or 150, that is it. Unfortunately, that is the limit. Now, if there are I'm mentioning 500 beds in the public sector. If you take 150 in AIMS, if you take 100 odd in Mekahara, which is the medical college, half is done. So half the state is ICU beds are there in just one city. So that is the big problem. We are trying to get sanction for 1,000 more ICU beds. Those facilities which infrastructure is standing there, in a short period of time we could convert. But again, we are 20-30 days behind what is required today.
So you mentioned oxygenated beds. So a huge requirement right now that we are seeing, as you also mentioned, is that young people are also requiring oxygen support. So states like Maharashtra have written to the centre asking for greater oxygen support, and they have asked for oxygen to be airlifted. So is Chhattisgarh also dealing with an oxygen crisis, or is there enough oxygen in the state?
Not a crisis yet. We happen to be among the largest producers of liquid oxygen. There's a plant in Bhilai, I believe, and there are other industrial units who also produce oxygen, but it was industrial grade. So we've asked them to step up and produce medical grade oxygen. Permits, etc., whatever formalities are required has been done. And we had installed during the course or the aftermath of the first wave, oxygen generating plants in our own colleges and hospitals. So that is coming in handy. We are fortunate to have taken the right decision in time before the crisis hit us. So 20 units from the state government side. When we started, the central government pitched in, we will also support you in this. So 4 from their side, of which 1 has been installed. We are waiting for the contractor to come and put up the other 3. And then the crunch for, rather than oxygen, the cylinders. The jumbo cylinders are in very short supply, and in a time of crisis like this, even the jumbo cylinder producing units are not being able to supply fresh cylinders. So the crunch is in the supply pipeline.
Infrastructure problems that have cropped up in this month has also led a lot of doctors and experts to say that there have been some wrong decisions that have been taken by the government. And one of the events that people are pointing to is the cricket match that was held in Chhattisgarh, in Raipur, in fact, in March. So a lot of people have raised concerns that was there a need to hold that cricket match, and has that cricket match contributed to this huge explosion of cases that we are seeing right now? In
That is,
hindsight, sir, what do you
very
think?
difficult to say. Very difficult to say. When the decision was taken to organize this cricket tournament, the positivity ratio, like I told you, had dropped to below 1. So the sense of people and the government also was that the cases are falling and things are not so bad. And if you are able to organize it in a particular way, it would be an event which would perk up the spirits of the people also, probably. But the surge has come with the organizing of the tournament. Some of the players themselves have got infected too. So people are seeing both the events having taken place parallelly. Where there's a crowd, we are having Kumbh Melas. Lakhs and lakhs and lakhs of people are coming together. We are having election rallies. Again, lakhs and lakhs of people are coming together. We are having other religious or let us say cultural events where a large number of people are coming together. So where even a marriage is seen as a super spreader events. These events hold the potential for the spread of the virus. There is no doubt about that. But if you see just the cricket match, was there a cricket match organized in Karnataka, for example, or in Maharashtra, or in Delhi, or in Uttar Pradesh? Now these cases are surging in all these places at a very fast rate. So you see these events parallelly because they took place in the same span of time. But there is no doubt that large gatherings or large events of any kind should be avoided.
So is there a sense in the government right now that there has been a laxity both on the part of the public as well as the government in the past few months when we saw that cases had dropped? There was a sense of complacency on both sides. Is there that sense now in the government in the hindsight?
Certainly, nobody was anticipating this, though everybody, we had tried to put it up again and again, and one tends to be bracketed as a doomsayer. When I had been saying that be prepared for a second wave. So then when the first wave has dropped and things have gone better, then people say, what nonsense is he talking about? Things have come down. So this is what is needed. You can't prepare or be in a position to meet a calamity if you don't have the infrastructure in place in advance. When the event comes, when you try to now meet the requirements of the exigency, you will not be able to do it. You will never be able to do it.
What this pandemic has taught us is to allot more resources to healthcare, to ramp up our healthcare infrastructure for such exigencies. But another political point, my final question to you that I want to come to, is that in the midst of all this, a kind of war of words is playing out between the Chhattisgarh government as well as the central government over vaccinations. And this is a health care emergency that the country as well as the state is dealing with. So how is that going to benefit the common man, and where is this headed, sir? Because you have said that there is a shortage of vaccines in the state and the center is saying that there is no such shortage, there's misinformation. So what happens now, sir? Where is this headed and where are we seeing this going?
You are absolutely right. One, I'd like to go back to your first comment that I hope we have woken up to the actual requirements for healthcare. Serum Institute of India is producing, it has a capacity of 6 crore vaccines, and the Bharat Biotech unit has a capacity of producing 1 crore vaccines in a month. So what is that? 7 crores. You divide it by 30, what is it? 23, 24 lakh vaccines in a day. Chhattisgarh has a capacity of 3.5 to 4 lakh vaccination capacity. So will all the vaccines come to us? So what should be said, what I feel is not that there is a shortage of vaccine in the supply pipeline. We should be saying that we are not being able to produce enough. We are ramping up the thing. I never said that the central government is not giving. I never said that. What I said was that there should be a plan where rationally we divide whatever is available in the country to those states who need it. You do that equally as per the population, and if you want to give a little extra to those states which are hit heavily or more hard, that is another decision. The fact again is we have a limited production capacity, and what is being produced is being attempted to be pushed down the supply pipeline by the government of India. They can only give us what is being able to be produced in the country. So the actual point that we should be discussing, or everybody should discuss, is how to ramp up the production or availability of the vaccine in the country.
Mr. T.S. Singh Deo is telling us on the print that there is a need for the centre and the states to act together and ramp up vaccine production across the country so that not just Chhattisgarh but all states have enough to inoculate as many people as possible as the second wave of the COVID virus rages across the country. This is Sravasti Dasgupta with Suraj Singh Bisht in Raipur for The Print.